a doctor diagnoses you as stage 4 cancer, that it is a death sentence.
Okay.
Now, another controversial issue about sugary drinks. Sugary foods, can cancer patients take them or not? Those who have this fighting ability, they want to fight the cancer, they live longer. Good day everyone, I have a very special guest, Dr. Peng Tiam, very famous Singapore cancer specialist, also in Southeast Asia. Dr. Peng Tiam is my personal doctor. So we are lucky to have him to answer truths or facts and myths about cancer. Sir, let's start. A doctor diagnoses you as stage 4 cancer, that it is a death sentence.
Okay. By and large, it is true that most stage 4 cancers cannot be cured. But to use the word death sentence is almost like, look, you're going to die very soon. And that's not true. Many of our stage 4 cancer patients live for very extended periods of time. There are some cancers that are very, very treatable. For example, in breast cancer, we have got stage 4 cancers that go well beyond 10, 20 years. Lung cancer, we're now talking about 5, 10 years. So while indeed we cannot cure stage 4 cancers, it doesn't mean that a stage 4 patient should not be treated and will die quickly. It is completely untrue.
What is the secret to prolonging their life?
There is really no secret. The secret really is understanding cancer. Every patient's cancer is not the same. By understanding the cancer, we need to know what is the best possible treatment. Once we can find the right treatment, many patients have the possibility of living extended life.
Now, another controversial issue about sugary drinks. Sugary foods, can cancer patients take them or not?
Cancer patients are allowed to take sugar. There is no data again to show that the patient who takes more sugar has a poorer outcome compared to those who do not take sugar. So please go ahead and take all the sugar that you want. It does not make a difference. If indeed sugar is such an important component, then you would say that patients who are diabetic will have a far poorer outcome because they've got higher blood sugar levels. No, it is not true. It is true that yes, cancers do require sugar in the metabolism, but it is not true that by taking sugar you will encourage the cancer to grow.
About cancer patients and their diet, what do you recommend they eat?
I generally tell people have a balanced diet. I mean, whatever you've always been told, you must have a balanced diet. There must be carbohydrates, there must be protein, there must be enough vitamins, you must take your fruits and vegetables. It is no different for a cancer patient. In fact, for a cancer patient, a balanced diet, a good diet, eating heartily is very important to keep strong during the process of cancer treatment.
So there's no secret mushroom or herbal?
I truly wish there was. I truly wish there was. I mean, if there is indeed a diet that can make a difference for my patients, I would tell all of them to do it. But the fact is that there isn't. We as doctors have one primary objective. We don't really care why patients get better. We only want them to get better. Whether it's through prayer, the power of prayer, whether it's through good nutrition, whether it's through positive thinking, whether it's through our treatment process, it doesn't matter. The important thing is that we work together to help cancer patients get better.
Does the placebo effect have an effect?
I believe so. I believe that's why it's very important to find a doctor you can trust, because when you have a doctor you can trust, you can fight the battle in confidence. Being fearful, being stressful, I think, any cancer patient will tell you, once they are unsure what is going on, that is when they really feel the most hopeless.
I read somewhere that those who have this fighting ability, they want to fight the cancer, they live longer?
Absolutely true. You see it now in our practice all the time. The patient who comes in completely defeated, if you cannot motivate them to fight, you cannot show them, to help them get that spirit, that fighting spirit, give them that sense of hope. These are the patients that die very quickly.
How do they fight?
Fighting is very difficult to explain. Fighting really is a desire, a hope to live. The desire to live longer, to live better. That's why it's not just the role of the patient himself or herself. It is also important that the doctor, the nursing staff, as well as the family members and friends to encourage and support the cancer patient in this battle. I'm sure you yourself will know what this is all about.
Oh, there are good days, there are bad days. But whenever I think of Dr. Ang, I get into better days.
You're very kind. Thank you very much.
So, are there foods that cancer patients should avoid, like raw foods?
Well, there's some people who do believe in that. There are many people who believe that when you're undergoing chemotherapy, your white blood cell may be low. You try to avoid raw food because, raw food will have some degree of bacterial contamination and your resistance may not be that good. But by and large, we keep a very close watch on patients' white blood cell. By giving boosters, very few of our patients really encounter severe lowering of the white blood cell. But there are some patients that despite all that we do, that white blood cell can drop, and these patients are indeed at increased risk of developing infection. So for safety purposes, you say you want to avoid raw food, I will say it is not wrong.